You're watching WBAL-TV, WBAL-DT Baltimore. Live, local, late breaking. This is WBAL-TV 11 News Sunday morning.
In this morning's health alert, we're talking about fatigue, specifically chronic fatigue and fibromyalgia. According to the Annapolis-based author of this book, you can have these diseases and still lead a vibrant, healthy life. Dr. Jacob Teitelbaum is here with more. Good morning, doctor.
Good morning, Kate.
All of us around here are interested in this because every single person you see here came in about 4 o'clock this morning, probably working on about 2 hours of sleep, so most of us are fatigued. How do you know the difference between just being tired and actually having chronic fatigue?
If you're exhausted because you're working or not sleeping because you're an anchor woman, it'll go away with vacation. You get a week's vacation, going to feel great. In chronic fatigue syndrome, it's more like blowing a fuse. You can go on vacation for 10 years. You're exhausted, you can't sleep, and you're going to ache all over. So it doesn't go away with rest. You can't sleep, you've got the problem.
So a way to know the difference is if you're tired all the time, but if you have a great nap on a Saturday and feel fine, you don't have chronic fatigue syndrome.
Correct.
Okay, what are some of the symptoms of chronic fatigue syndrome?
Well, the classic ones are exhausted and can't sleep, brain fog, if you hurt all over.
You mean like achy hurt? Okay.
And it can be severe. We have people coming in on morphine who come to our clinic.
Really?
It can be very, very devastating. The cold intolerance is common, numbness and tingling, loss of libido. A study in our clinic showed an average 32-pound weight gain, which also goes away with treatment.
Oh, wow.
So that's good.
How do you treat it?
Well, the research has shown that 91% of patients improve, and people can see the studies on our website. They've been published. If you treat sleep, hormonal problems, infections, and nutrition. And it takes a lot to treat sleep. There's natural things. Sun-theanine is a wonderful herbal from green tea, which is excellent for anxiety, excellent for deep sleep. There's valerian and lemon balm. The book will talk about many, many different natural remedies, and many people need to take sleep medications with it.
Now, you said, did you say something like most of the patients, CFS patients, are women?
3/4 of the people who have it are women. That's the case with most immune diseases, MS, rheumatoid arthritis. Woman has to carry a baby for 9 months. The man's immune system would reject it. So the immune system is different in a woman, and 3/4 of the people who get it, which is one reason why doctors blow people off with the disease.
Yeah, I was just going to say, I feel like I know some people who may have this, but there seems to be a stigma that it's maybe kind of a phantom disease. It doesn't really exist.
It's the same thing that happened to multiple sclerosis before we had a definite test. People with MS were being called, told that they had hysterical paralysis. Same thing with lupus. These are predominantly women's diseases. Until we had a test, the doctor said, I don't know what's wrong with you, so you're crazy, which is a nasty thing to do to somebody. Our study has showed this is a very real disease because the active group, 91% of people got better, placebo group only 30. Okay,
and in our last 30 seconds, if you think you may have it, you should not, I'm assuming you would say you should not be embarrassed to go talk to your doctor about it. Is that what you should do? Go talk to your primary care physician?
Well, you want to go to a specialist in it. We see people from all over the world in our Annapolis clinic, but there's now a chain called the Fibromyalgia and Fatigue Centers of America. You can go to fibroandfatigue.com, and there are clinics all over the country with doctors who know what they're doing. So don't go to a doctor who's clueless. You don't want to come to me for heart bypass. You don't want to go to them for fibromyalgia and chronic fatigue syndrome.
And is there more information in your book on where you can go for help and your website and all that?
Absolutely.
Okay.
People go to vitality101.com. They'll get all the information they need on how to get well.
Dr. Jacob Teitelbaum, thank you so much for coming in. Again, the name of his book is From Fatigued to Fantastic. You can find it in bookstores now, and hopefully we helped some people out this morning. Thank you, doctor.
Thank you.
And